I'd always had an interest in palliative medicine and really trying to support the most vulnerable population. Um, but I found myself having these conversations almost every day in the middle of that pandemic, and I found that I really enjoyed helping those people. So I am the palliative medicine and supportive care specialist. We focus primarily on helping manage symptoms and having complex medical decision-making conversations for patients with serious illness, whether it's heart disease or maybe we just had a big stroke. Obviously, cancer is probably the most recognizable the reason why we get involved in people's treatment, but it can be any organ system that's failing, and as soon as we have a major diagnosis of that, we can be involved. So the way I describe palliative medicine in general is, what is our life story? Where are we coming from? How were things before now? Where are we at right now? And then what does the future hold? Trying to get a better understanding of where they are at in their life's trajectory and what issues they're having, and trying to answer some questions that I'm sure that they've had that they haven't been able to get answers to, or maybe they're confused about what the answer is. We just try and lay it out so that whenever we're making big decisions, we have all the information on the table. The main thing that we focus on, the whole crux of palliative medicine, is on patients' quality of life. A lot of times they're deciding on whether or not they want to continue treatment, or maybe they're in the middle of treatment and they're really struggling with it, and they want more direction. Our services will touch on a lot of that and be able to hopefully help guide them one way or the other, and try and make it a little more clear for them and their families. Here in the hospital, a lot of times we get involved whenever we're maybe at a standstill, or maybe somebody's really sick and they aren't recognizing and they're struggling with the fact that they're really, really sick. Or maybe family members are struggling and need support. Outside of the hospital, a lot of times we'll work hand in hand with a provider in the community. A lot of times it's the oncologists, trying to have them referred to our clinics so that we can help manage some of their symptoms, whether it's cancer-related pain or constipation or something like hiccups. So being able to be a part of their journey and help them make the decisions that best align with their goals and their values, that is the most rewarding thing at the end of the day. So I'm not at the hospital. I enjoy I'm a big live music fan, so a lot of times people can find me roaming around at Blossom Music Center or up in Cleveland.